So I've been working on this for a few months now. We've had a good amount of incidental filters captured or mentions identified, about half of which we've been able to review to date. And it does take a little bit of a deep dive when you're just going through a chart to work backwards, because most of the filters of the incidentals were not placed by us. They're placed at outside institutions. And then, you're reaching out to a patient. It's a little bit challenging to be like, you may have never known this, you may not feel anything from it, but you have an IVC filter, and based on medical literacy, you can only imagine how much how that conversation may go. So, what that initial outreach, I think there's room for me to grow in terms of curating that conversation. Surprisingly, there's a good amount that are eligible for filter removal, and these numbers change based on the demographics. Like the younger patients seem to have a little bit more reasons for having them removed. Some patients that are a little bit older and especially in the 80s, and they're in long-term care facilities and things like that, you'd be surprised there's a lot of filters in those patients. So it's just a little bit logistically challenging to navigate those. The tool that is used to navigate freshly placed one is really helpful, because traditionally, I don't know how other people do it, but you may use a combination of email and Excel and different ways of tracking patients when you've had filter placements. In a prior life, we were using a notebook with writing patients' name down. So it's nice to just have a one-stop shop where all the filters you placed are easily tracked, and you can actually see how old they are. Once they hit 3 months, you just kind of get the ball rolling on evaluating them to have them removed. The other benefit of it is it's not just, we talk about filter retrieval, but that's a small percentage of it. There's a good amount where you just manage them. You bring them in, you talk to them, you get imaging, you let them know what's going on with their filter, manage whether they need anticoagulation, have that conversation, maybe do some lab works. And that part of it is equally important. And there's also revenue associated with the office visits and referring for imaging. This is just a case that I wanted to include. This was a 58-year-old female who had a history of giant cell tumor that was resected in 2000. She had a post-op DVT. They placed a filter at the time in Greenfield. She was discharged and never knew about it. She came in to Sinai for abdominal pain. The filter was noted on the incidental tool. I had reached out to her and talked to her about it, brought her into clinic, got a CT, and the CT, it's not the best representative picture, but her IVC had some thrombus in it, and it was narrowed. It didn't look great. There was struts sticking out. She had described some vague abdominal pain. I couldn't necessarily chalk it up to the filter. I laid it out to her about the risks of removing versus leaving it in, and let her think about it. Her and her daughter did a bunch of research on filters. She had never known prior to this that she had an IVC filter, and she actually called back to get it removed, understanding the risks. And we removed it safely in one setting, and she was very thrilled to have it removed. So it could be you're helping a lot of patients that may or may not have known that they had a filter.